Hello and welcome to the Galway News. More than 1 million people have given up smoking since the COVID-19 pandemic hit. A survey for Charity Action on Smoking and Health, ASH, suggests of those who had quit in the previous 4 months, 41% said it was in direct response to coronavirus. Separately, University College London found more people quit smoking in the year to June 2020 than in any year since its survey began in 2007. Government advice says smokers may be at risk of more severe COVID symptoms. Between the 15th of April and 20th of June, a representative sample of 10,000 people enrolled by pollster YouGov on behalf of ASH were asked about their smoking habits. The results were used to estimate the total number of people giving up smoking in the UK. Just under half of people who had quit in the past 4 months said the pandemic had played a role in their decision. That may have been down to a range of factors, including health concerns, access to tobacco while isolating or no longer smoking socially. A team at University College London has been asking 1,000 people a month in England about their smoking habits since 2007 as part of a smoking toolkit study. In the year to June 2020, 10.6% of smokers taking part in the survey quit, almost a third higher than the average and the highest proportion since the survey began more than a decade ago. On average, 5.9% of surveyed smokers quit per year since 2007. ASH Director Deborah Arnott said over 1 million smokers have succeeded in stopping smoking since COVID-19 hit Britain, but that still leaves nearly 5 times as many who have carried on smoking. About 7 million people in the UK in total were smokers in 2019. ASH is launching a Stop Smoking campaign funded by the Department of Health and Social Care, targeting people in the areas of the country with the highest rates of smoking. Terence Craggs, who lives in Newcastle, quit smoking after spending time in hospital on oxygen, although his coronavirus test was negative. "I could hardly breathe," he said. "I was hunting for air all the time. The pandemic is more of an incentive to stay off them, even though it's more difficult at the moment because of the stress." The North East has seen a bigger fall in smoker numbers than anywhere in England since 2005. So, what are the risks? Data from the Zoe COVID symptom tracker app suggested smokers were 14% more likely than non-smokers to develop the 3 classic symptoms of coronavirus infection: fever, persistent cough, and shortness of breath. The app, created by researchers at Guy's and St Thomas's Hospitals and King's College London, analysed data from more than 2.4 million UK participants. Their analysis found smokers with a positive COVID-19 test were more than twice as likely as non-smokers with coronavirus to be hospitalised. This aligns with research from the US, which found hospitalised smokers with coronavirus were 1.8 times more likely to die. Although the small number of smokers in the Zoe study who took a coronavirus test appeared to be less likely than non-smokers to test positive, they were more likely to report serious symptoms. Some studies from around the world have suggested smoking may actually have a protective effect against coronavirus. This is based on groups of hospital patients where smokers seem to be underrepresented compared with their numbers in the wider population. Dr. Jamie Hartman-Boyce from the University of Oxford's Centre for Evidence-Based Medicine said there was a biological plausible explanation that nicotine could be blocking the same receptors used by the virus to get into your cells. But she said the clinical significance of these is entirely unclear, and this isn't consistent across studies, and it's unclear if the data from these studies are reliable, she said. Smoking itself, rather than just taking in nicotine through a patch or gum, is uniquely deadly, she pointed out, meaning that the health harms far outweigh any potential benefit. Public Health England's guidance states there is strong evidence that smoking tobacco is generally associated with an increased risk of developing respiratory viral infections. Smoking causes damage to the lungs and airways and harms the immune system, reducing your ability to fight the infection. So, what do you think of this? Personally, from my point of view, I've never smoked, so actually I think this is a great news that actually the virus seems to be scaring people out of smoking, because there are some who are so addicted to the nicotine that it becomes impossible for them to do that. Actually, the fear of the virus and the real fear of potentially dying as a result of something you do is actually, I think, one of the, well, it's an incredible motivator for a lot of people. I think also that as someone who doesn't like smoking, the reduction means I'm not going to get all these passive smokers and those who smoke, try and blow smoke in your face around. Hopefully the same can be said for the vaping eventually, because I just don't like it. I think it's a dirty habit. Whatever you think, leave your comments down below. Like the video if you enjoyed it, and don't forget to subscribe.